This is a video explaining what rate ratios are and how rate ratios are calculated for the UK Armed Forces Mental Health Annual Statistic. This is produced by Defence Statistics Health in the Ministry of Defence. The report provides statistical information on mental health in the UK Armed Forces. It summarises all initial assessments for a new episode of care of service personnel to the MOD's Specialist Mental Health Services. The services are the Departments of Community Mental Health for outpatient care and all admissions to the MOD's inpatient care provider. There has been interest in understanding whether deployment to Iraq and/or Afghanistan has an impact on the mental health of service personnel compared to service personnel who don't deploy to either Iraq and/or Afghanistan. In the report, this is presented by rate ratios. Say you have two separate populations. A rate ratio can be used to compare the rates an event occurs in these two populations. Calculating the rate ratio is done by dividing the two incidence rates of the two populations. The incidence rate of a population is the amount of people that experience the said event, divided by the population at risk. The population at risk is anyone who could experience the event in a specific time period, and the event could be almost anything. For example, the event could be listening to music, so the incidence rate of one population would be the percentage of people in that population that listen to music. After calculating the rate ratio, you then compare the rate ratio to 1. Bearing in mind that the rate ratio can't be negative, the further away from 1 the rate ratio is, the larger the difference between the two rates. So, the rate ratio is one incidence rate divided by the other. I should point out, however, that it doesn't matter which rate is on top of the fraction. If the rate ratio is equal to 1, then this means that the two incidence rates are equal. If it's larger than 1, then the incidence rate on top of the fraction is larger. If it is smaller than 1, then the incidence rate on the bottom of the fraction is larger. Now here's an example on how rate ratios are calculated. Say we have two populations. Population A has 400 people, and population B has 100 people. These will be our populations at risk, and any of these people could experience our event. Let's say the event is listening to music, and the populations will watch for a day to see if anyone listened to music. Now, if 80 people in population A listen to music, and 50 people in population B listen to music, then these are the amounts of people in each population that experience the event. To get the incidence rates for each population, you then divide the number of people who experience the event by the total amount of people in that population. So these are our incidence rates and can both be simplified down. What this means is that for population A, 20% of the population listen to music and 50% of population B listen to music. Now, to get the rate ratio, we are going to divide the incidence rate from population A by the incidence rate of population B. This gives us a rate ratio of 0.4. As this is less than 1, this shows that for this example, population A had a lower percentage of people who experienced the event than population B. Now, we will use an example from the mental health report. In the report, rate ratios are used to look at any service personnel who are assessed with a new episode of care for a mental health disorder at a DCMH. We then see if they have previously deployed to Iraq and/or Afghanistan, or if they hadn't previously deployed to Iraq and/or Afghanistan. If they had previously deployed to either Iraq and/or Afghanistan at any time before the assessment date, then they will be included in the deployed population. From Table 3 in the web tables of the report, in the financial year 2015-16, we have 5,366 new episodes of care of service personnel assessed for mental disorder at an MOD DCMH. Of these, 3,312 had previously deployed to Iraq and/or Afghanistan, and 2,054 had not previously deployed to Iraq and/or Afghanistan. These are the number of personnel that experienced the event. Overall, in 2015-16, of the personnel still serving, 94,155 personnel had previously deployed to Iraq and/or Afghanistan, and 68,424 personnel had not previously deployed to Iraq and/or Afghanistan. These are our populations at risk. We divide the amount of people that experience the event by the population at risk. We do this for both populations. After dividing these and multiplying by 100, this shows that around 3.5% of personnel still in service in 2015-16 who had previously deployed to either Iraq and/or Afghanistan were assessed for a mental disorder at a DCMH in 2015-16. It also shows around 3% of personnel still in service in 2015-16 who hadn't previously deployed to Iraq and/or Afghanistan were assessed for mental disorder at a DCMH in 2015-16. We then divide these two incidence rates to get a rate ratio of 1.2. As this is bigger than 1, the incidence rate on top of the fraction is larger than the other incidence rate. Therefore, for this example from the report, this means that of the personnel still in service, the rate of new episodes of care for mental disorders in those previously deployed to Iraq and/or Afghanistan was higher in 2015-16 than those not deployed there. But is this statistically significant? To see if it is statistically significant, we see if the 95% confidence interval includes 1. If it doesn't, then the difference in rates is statistically significant. This was a confidence interval that was calculated, and as you can see, the confidence interval doesn't contain 1, so this shows that the result is statistically significant. Thus, we can conclude that the rate ratio reflects a statistically significant difference in rates. This means in 2015-16, if service personnel had a new episode of care for a mental disorder at a DCMH, then they are more likely to have deployed to Iraq and/or Afghanistan. If you want to know more about rate ratios, confidence intervals, or statistical significance, then please see the report on the background quality report found on the gov.uk website.